Okay, so I start by doing my hand hygiene, and then I introduce myself. Hi, I'm Lisetta, student nurse from TCC. Can you please verify your name and date of birth for me?
Graciela Montoya, and 2677.
Okay, great. So I'm going to be performing a head-to-toe assessment on you today. Is that fine with you?
Yes.
Okay, I'm going to start by asking you a couple questions. Do you know where we are?
Yes, my house.
Okay, great. Do you know what year we're in?
2020.
Okay, good. So, are you experiencing any pain? If you are, on a scale from 0 to 10, what's your pain right now? With 10 being the worst?
0.
Okay, good. So I'm gonna start by assessing your eyes. I'm gonna shine this light straight up to your eyes. Please make sure to look straight ahead. Okay. So then right here, we make sure that her pupils are reactive to light, which they were. And then we pull this down and make sure that it's nice and pink. It's pink. And then let's check this eye. It's pink. And then, do you wear any contacts or glasses?
No.
Okay. And then we also check for the swelling of the eye, and her eye is not swollen. And we check for signs of jaundice, which she does not have. Next, we're going to check her ears, and we check for dryness and redness. Okay, this one looks great. Let's check the other one. Okay, that one looks good too. So now we are going to check her nose and make sure it's not red or dry. I mean, it's not red and it doesn't have any drainage. Sorry. Okay, it does not have any drainage. Are you having difficulty breathing?
No.
Okay, and then are you having difficulty smelling?
No.
Okay, good. So now I'm gonna ask you if you have any difficulty chewing or swallowing.
No.
Oh, do you wear any dentures?
No.
Okay. So now we're gonna check her mouth. Please open your mouth and stick your tongue out. So as we can see, her tongue is nice and moist and pink. And there's no lesions and no cavity. So that looks good too. Next, we're going to check her neck. Can you please sit up? Thank you. So please turn to the side. Okay, and then turn to the other side. Okay. So what we assess right here is her jugular vein. And we make sure that there's no signs of distension, which she does not have either. Next, we're going to check her respirations and heartbeat. So we start by assessing the 4 spots, which are the aortic, pulmonic, tricuspid, and mitral. So we're going to start with the aortic, which is right here. Okay, if you don't mind, I'm gonna check your apical pulse. And then I'm gonna time that to see what her Okay, so her heart sounds great. Her pulse is 68 beats per minute, which is within the normal range. So now we're going to go and check her respirations. And we're going to make sure that both of her lungs sound the same and we hear the same sounds. So I'm going to do that in the back. And we start by checking one lung and then moving to the other one and to make sure that we are hearing the same sounds. In the zigzag motion. And right now is a great time to check her respirations as well. Okay, so I counted her respirations and I got 18, which is within the normal range. So now we're gonna assess her abdomen and we're gonna palpate to check for tenderness. And I'm gonna ask her if she's having any pain. So I'll palpate. I will lift up her shirt, but it's fine. Are you having any pain?
No.
No? Okay. So next we're gonna check each quadrant for bowel movements or bowel sounds. I'm gonna start by listening to the upper quadrant. And then I listen for a minute in each quadrant. Okay, I am hearing bowel sounds in the upper one. Gonna move to the bottom one, the lower one. Okay, so they sound great. So now we're gonna check for urine. I'm gonna ask her if she's voiding regularly.
Yes.
Okay, and then I'm gonna ask, what color is your urine?
Yellow.
Yellow. Is it cloudy or clear?
Clear.
Okay, great. So are you having any burning sensations or incontinence, any sort of?
No.
No? Okay. So good. So her urine sounds like it's good. So now we're going to check her feet and we're going to check for swelling or edema. And there's no edema or swelling in her feet. So now we're going to try to listen to her heartbeats or dorsal. So we're going to try to find it. It's usually right here. And we're going to see how much I'm going to check her lower extremity. Okay, I got about the same as I did with her apical pulse. So now I'm going to ask you to move your foot front and back and then side to side. So she can move it, which means she's having an active range of motion, which is good. So now I'm going to ask you to try to push my hand with your foot. Okay. And then, okay. So she has good strength on her feet. And since she has no edema or active range of, she has an active range of motion, she has a good skin integrity. So now we're going to check the rest of her skin and we're going to make sure that it's not dry. And we're going to assess the color and moisture. And the color looks good. It has moisture. It's not too dry. It's not too moist, which is good. And then we check if she has any ulcers, lesions, bruises, anything of that sort. And I did not see any. So after that, since we assessed her skin and everything looks great, we do our hand hygiene and we lower the bed all the way down. We put the side rail up and then we tell them to use their call light if they need any help. And then I exit the room and do